Guys, welcome to another video of Love in a Mist, and today I'll be talking about cardiopulmonary resuscitation, which is known as CPR. So the heart and lungs work together. Air breathed into the lungs gives oxygen into the blood. The heart circulates the blood, carrying oxygen to the brain and to the rest of the body. If a person stops breathing, his heart may keep beating for a short time. In this case, he needs mouth-to-mouth resuscitation. If his heart stops beating, his breathing will also cease. If this happens, cardiopulmonary resuscitation is needed. In the term cardiopulmonary resuscitation, cardio refers to the heart and pulmonary refers to the lungs. CPR is a process invented in 1960 and is the combination of mouth-to-mouth resuscitation, which supplies oxygen to the lungs and chest compressions, which circulate blood to the body. CPR was put in place for people to be trained to help keep someone alive in the first critical moments of a person's heart stopping or of a person's breathing discontinuing until proper medical help arrives. The American Heart Association has developed an easy way to help recruiters remember the steps of CPR. Simply use the ABCs for the process: A. Airway, B. Breathing, C. Circulations. Now let's go to the process of CPR. The breathing process works simply by inhaling and exhaling air. The air we inhale goes to our lungs. Oxygen from the air is then extracted into the blood and pumped through the heart into body organs and tissues. Cardiac arrest occurs when this process is interrupted and a person goes unconscious. This will then result in heart failure and eventually death. This can occur naturally, such as head injury, near drowning, electrocution, or severe trauma. The normal heartbeat would then become irregular and eventually would cease to function altogether. Cardiac arrest occurs when this process is interrupted and a person goes unconscious. This will then result in heart failure or eventually death. This can occur naturally, especially among elderly people, or unnaturally for any person of any age as a result of an accident such as a head injury, near drowning, electrocution, or severe trauma. The normal heartbeat would then become irregular and eventually would cease to function altogether. Trained personnel are then called upon in this emergency situation to administer CPR according to current guidelines in order to revive a victim suffering from cardiac arrest. CPR may or may not save a person's life even when administered properly, but if it is administered within 4 minutes from the time cardiac arrest began, the chances of survival increase by 40%. Next point, I'm going to talk about preparation for CPR. When preparing to begin CPR, first check to see if the victim is conscious or unconscious. Then check for breathing. Once this is accomplished, call immediately for emergency help and begin CPR only if you are trained in this procedure. You should follow current guidelines for CPR. Other first aid techniques do not guarantee successful results. Knowing basic life-saving procedures will make it possible for you to help others. We recommend taking a course in CPR from the American Red Cross or the American Heart Association. These courses familiarize the student with the basic techniques and allow practice using mannequins, which are designed to respond like a real person. So this is all about cardiopulmonary resuscitation or CPR. And yeah, I have taught the process of CPR, some of the guidelines, and the preparations for the CPR. So I hope you guys learned something from it, and thank you for watching, and I see you in the next video.